Hi, in this video I'd like to talk about the remedies for your hysterectomy side effects. So in our previous video we've already talked about the potential dangers and risks of these lifelong side effects that your doctor don't really talk about, even though recommending you for hysterectomy for your condition. Now again, we'd like to explain to you that here at Antai Hospital we will only recommend hysterectomy if the underlying condition is malignant or life-threatening to the patient. Otherwise, for cases such as uterine fibroids, endometriosis, adenomyosis, hysterectomy is not required because it's very destructive and carries lifelong side effects. So if you'd like to find out the side effects, please watch our previous video. In this video, we will talk about each side effect's remedy that can actually help increase your quality of life and potentially solve it as well. The first one we'd like to talk about is the urinary incontinence, which means you're unable to empty your bladder completely. Now, for this side effect, Antai Hospital offers a unique surgery that uses this transobturator tape, which is a medical tape that is safe and non-reactive, that is actually inserted via the vagina using laparoscopy, and then it will sit right at the urethra, and this surgery can actually increase the control that you have of your bladder, actually give you much more control to allow you to empty this bladder, give you much more control so that you no longer face this accidental urinary leakage that this urinary incontinence commonly causes. The second side effect that we can talk about is the urinary retention, which means you're unable to completely empty your bladder. And then the third one is constipation. These two has the same treatment method. What we do here is that we will insert a biopatch. We're trying to graft a biopatch according to which side effect. So urinary retention, we will be grafting this biopatch. This biopatch is made of a human cadaver skin, which is sterile. At the same time, we will be grafting it on the posterior wall of the bladder, which means the back wall that is facing the uterus. This grafting here will actually cause the wall to thicken, acting as a scaffold, supporting wall. And this will actually increase a lot of control. It will not restore it 100%, but it will increase significantly. So for the same thing as constipation, we will be grafting this biopatch on the posterior wall, which means the wall that is facing towards the uterus, the posterior wall, the front wall of the rectum. And then the same thing happens. Over time, this biopatch actually thickens, and then it acts as a scaffold, a supporting wall, so that the rectum actually has something to support itself on. And then this will actually relieve the symptom of the constipation and urinary retention. Next up is the drooping of the pelvic organs. Now this is the most serious of all the side effects, and this side effect is actually a priority treatment. We need to actually take this side effect much more seriously, because if you actually treat this side effect alone, all the other side effects will usually be treated as well. It will be alleviated as well, because all of it is connected to the pelvic base, the pelvic bones. So for the drooping, which is the significant pressure, the bulging in your lower abdomen, what we recommend is a pelvic reconstructive surgery that inserts a supporting base within the pelvic cavity to actually restore the strength of the pelvic bone, the pelvic muscles, and also restore the original positions of all these drooping organs. You will feel much more better, you will feel the pressure alleviated, and at the same time all the other pressures, the side effects also alleviated at the same time. Next up is the onset of menopause because of the ovarian failure. Now for these types of side effects, then we will actually recommend hormonal replacement therapy, specifically the replacement of estrogen, because estrogen is very low now. The ovaries probably is not even producing anything. So we will need to restore according to your needs. In general, we will actually supplement your estrogen levels to your childbearing years, which is a healthy and quite high level, but not more or not less than that level. We will be looking at a healthy childbearing age at the age of 20 to 26. And finally is in chronic depression, which is the emotional instability, the increased irritability that a lot of women face after going for hysterectomy for long periods of time. For this side effect, best way is medication and also a combination of counseling or talk therapy. That is the best form of treatment that we can recommend you, and actually gives you a lot of benefits as well. So medications such as antidepressants, anti-anxieties actually calm your nerves and actually make you feel much more relaxed. With the combination of talk therapy, talking to a counselor or a therapist can also help you significantly release this burden, especially mentally. So here at Antai Hospital, we again would like to say that we do not recommend hysterectomy. Do not go for it, even if your doctor recommends it. To always ask for second opinion. Unless it's life-threatening or malignant, don't go for hysterectomy. Otherwise, you will need to deal with all these side effects. And not only for a short while, it's actually lifelong. And you cannot have children anymore as well. So if you'd like to seek treatment for these remedies for hysterectomy side effects, please get in touch with us via our website. If you'd like to seek treatment for other conditions related, please also visit our website. Leave me a comment down below as well.